Did you know that over 38 million people are living with HIV globally? And since the epidemic began, an estimated 36 million people have died from AIDS-related illnesses. But beyond the devastating numbers, HIV has transformed society in ways that no one could have anticipated. Today, we're exploring how HIV forever changed the way we think about health, community, and equality. Hey everyone, welcome back to the channel. In today's video, we're going to talk about one of the most profound health crises of the 20th century, the HIV epidemic. This virus not only changed the medical landscape, but also reshaped society's attitudes towards sexuality, health, and human rights. HIV forced us to confront deep-seated stigmas and misconceptions, and it played a huge role in shaping modern healthcare. So let's take a closer look at how HIV has had a lasting impact on society, and why it's a topic we can't afford to forget. When HIV first emerged in the early 1980s, the world was caught off guard. People didn't know what it was, how it was transmitted, or how to stop it. In those early years, the virus was shrouded in mystery and fear, with devastating consequences. Misinformation spread rapidly, and so did the stigma. HIV was often associated with marginalized groups, especially the LGBTQ+ community, injecting drug users and sex workers, leading to rampant discrimination. But it wasn't just social stigma. Healthcare systems were overwhelmed by the sheer number of cases, and there was no cure or effective treatment in sight. For many, receiving an HIV diagnosis was essentially a death sentence. Let's dive deeper into the ways society responded to this growing crisis. One of the earliest and most widespread reactions was fear, fueled by misunderstanding. Many people believed that HIV could be spread through casual contact, shaking hands, sharing food, or even being in the same room as someone who had the virus. This led to social isolation for those infected, further deepening the stigma. Public figures like Ryan White, a teenager who contracted HIV through a blood transfusion, helped shift public opinion by showing that HIV could affect anyone. At the same time, there was an urgent need for a medical response. The HIV epidemic quickly became a global health crisis, and governments, healthcare providers, and activists all had to figure out how to deal with it. In the early days, the medical community was scrambling to understand how the virus worked and how to stop it from spreading. AIDS wards were established in hospitals, and healthcare workers had to take extra precautions to protect themselves from infection. But despite the best efforts of doctors and researchers, the virus continued to spread, and the number of deaths climbed. In the face of this overwhelming tragedy, advocacy and activism began to emerge as powerful forces. Groups like ACT UP, AIDS Coalition to Unleash Power, took to the streets to demand better healthcare, more funding for research, and an end to the stigma. Their efforts led to increased awareness of the epidemic and helped to change public policy. Awareness campaigns also started cropping up, with slogans like "Silence equals death," and high-profile public figures raising the visibility of the crisis. These awareness campaigns also played a role in changing healthcare policies. Governments around the world started to recognize the need for coordinated responses to the epidemic. In the US, for example, President Reagan finally acknowledged the HIV crisis after years of public pressure, and Congress passed the Ryan White Care Act, which provided funding for HIV care and services. This marked the beginning of a more organized effort to manage the epidemic, with increased funding for research, education, and prevention. Of course, one of the most significant medical breakthroughs came with the introduction of antiretroviral therapy, ART, in the mid-1990s. This was a game changer. For the first time, people living with HIV had access to treatments that could manage the virus, prevent it from progressing to AIDS, and drastically improve their quality of life. The introduction of ART transformed HIV from a terminal illness into a manageable chronic condition. This development also had a huge impact on public health and healthcare systems, shifting the focus from crisis management to long-term care and treatment. The pivotal moment in the fight against HIV came with the widespread availability of antiretroviral therapy. ART didn't just change the lives of individuals living with HIV, it changed how society viewed the virus. The fact that people could now live long, healthy lives with HIV challenged the fear and stigma that had surrounded the virus for so long. In 1996, Time magazine called ART the Lazarus effect, referring to the way people who were once on the brink of death suddenly had a new lease on life. This moment marked a turning point, not just in the fight against HIV, but in how society approached healthcare for those living with chronic conditions. Today, HIV continues to have a lasting impact on society. It changed the way we think about public health, pushing governments and healthcare systems to be more responsive to epidemics and crises. It forced conversations about sexuality, human rights, and equality, particularly in how we view marginalized communities. The HIV epidemic also paved the way for advancements in medical research and treatments that benefit all of us. While there's still no cure for HIV and millions of people continue to live with the virus, society's understanding, acceptance, and support have come a long way since the early days of the epidemic. The lessons we've learned from HIV continue to shape how we respond to health crises and fight stigma. Now I want to hear from you. How has HIV impacted your life, or what changes have you seen in society as a result of the epidemic? Share your thoughts in the comments below. And if you're interested in learning more about how global health crises have shaped society, be sure to check out my video on the lasting effects of pandemics. Don't forget to subscribe and hit that notification bell for more deep dives into important social issues.